Welcome everyone to our Strong Start and Beyond webinar. The focus is on maternal well-being during the holidays. And I am so pleased that folks are able to join. We are recording this webinar series and it will be posted on our website. So if you wanted to share the word and want folks to listen to what we're saying, it's going to be available. It's being recorded. Also, just to keep folks on the know, you will have an opportunity to ask questions using the Q&A function. So please note, use the Q&A function to ask questions, and the responses will be provided as they come in. We welcome one-on-one conversation beyond today's webinar, so please reach out on Strong Start and Beyond at osg.ca.gov, and you'll see that at the end. That's going to be an opportunity for folks who want to reach out. The session is being recorded again, and next week we hope to have it live on our website. My name is Dr. Diana Ramos. I am the California Surgeon General, and again, just want to welcome folks. This is our agenda. So I've done our welcome. We're going to move into our introduction and highlight the great work that Dr. Elissa Epel is focusing on. And then I'm going to share a resource that has been developed by our office and a couple of call to actions that we're going to ask folks. Can I have the next slide, please? So it is my honor and pleasure to introduce to you Dr. Elissa Epel. Dr. Epel is a professor and vice chair in the Department of Psychiatry at the University of California, San Francisco, UCSF. She is the director of the Aging, Metabolism, and Emotion Center, member of the National Academy of Medicine, past president of the Academy of Behavior Medicine Research, and co-chair of the Mind and Life Institute Steering Council. She is leading a mental health council as part of the UC-wide Center for Climate, Healthy, and Equity, focusing on climate distress to activation. She has disseminated many science-informed practical resources to the public, including the stress prescription and the telomere effects, 2 books that are now published in over 20 countries. There are many other accolades in Dr. Epel's bio, but those are some of the highlights I wanted to share. I had the pleasure of learning about her work from a meeting that I attended as part of the First Partners gathering a few weeks ago, and I thought, wow, the work is amazing in terms of wellness, not only for the mom that is experiencing the benefits of the program, but more importantly, as you're going to hear, the longitudinal impact on the children that are that the mom was pregnant with. But I'm going to let Dr. Epel share the great work that she is doing. Dr. Epel, I will turn it over to you.
Thank you so much, Dr. Ramos. It's such a pleasure and an honor to speak to your office and this audience who is working in this area. This is our highest goal is to share and disseminate what we have spent the past decade studying. So I'd like to tell you a little bit about the science behind our class, our intervention that we tailored for low-income, overweight, or obese pregnant women. And I'd like to first acknowledge my collaborators who we've been working closely over the past decade to create a science-based, empirically supported intervention for mental health. And so this is a real passion we share. Nikki Bush has been studying the infants of the women in this intervention. Barbara Raya from UC Berkeley is a nutritionist, and Cassie Veaton from UCSD is an interventionist. And so we've all been working closely together. And so just to start with, I have also been studying the relationships between mental health and nutrition. And we know that there's a paradox, a stress eating paradox, which is that when we feel stressed, some of us might eat more, and some of us might actually lose our appetite and eat less. And we actually have a pretty good understanding at this point of the high risk pattern of eating more. And this happens more to women. We tend to choose what we call comfort food or highly palatable food, high sugar and fat, that is in a sense self-medicating, but that benefit only lasts minutes and has longer term effects on our health. Stress impacts what we choose. So instead of choosing carrots, we don't tend to stress eat or binge on carrots, but rather the highly palatable food. It changes how we metabolize food. It pushes our metabolism toward a pre-diabetic state. And it also impacts our fat distribution. It causes the fat to be stored in the intra-abdominal area, which puts us at more risk for metabolic health. And that's just a general risk factor for really all the chronic diseases that we worry about: diabetes, heart disease, cancer, dementia. So this is just a simple diagram of what we do know from both animal and human studies, that stress stimulates the reward center in our brain and creates a habit loop, so that when we're stressed, we tend to be conditioned to want to grab for the cookies or the chips. And it's a system analogous to low-grade addiction. There's cravings, and then there's more dopamine or reward when we end up eating when we're stressed. And you can see here this dotted box around the prefrontal cortex. What we also know is that to counter this automatic loop that can develop, we can use awareness and mindfulness to break that cycle and to give us some emotion regulation and more control over impulses and stress eating. This is very relevant for pregnant women. We know that during pregnancy, cravings are very strong, and if someone is already overweight, they're at much higher risk of excessive weight gain during pregnancy. So it's a very sensitive period, both for the mom and the baby's health. We also know that the pregnancy is shaping not only mom's health, but also the offspring's health. And those baby girls are also then having influences on their own health, the health of gametes, that then influence their own pregnancy. So there's really a cross-generational influence of pregnancy across generations. And so we've been studying offspring as well as moms. I'm going to show you the results from a study from a class. We developed a class over about 8 years, and then we have been following the women from this class for about 8 years. What we know is that for these high-risk women, low-income women who tend to be overweight from Northern California, there's a tremendous amount of stressors during pregnancy. So they have more stress than higher income women. They have food insecurity. They live in unsafe neighborhoods. So what can we do about this? We've asked whether mindfulness training during this sensitive period when there's greater stress exposure can help. Now, of course, providing structural resources is also critical. We need both help for emotional resilience, but also to have their basic needs met. So we just simply ask the question, can we reduce the cravings or the hedonic drive? Can we reduce excessive weight gain and risk of diabetes? And can we prevent the excess incidence of depression and anxiety during and after pregnancy? So I'm going to show you what we found and tell you a bit about this study. Now, we already know that mindfulness training is a very effective class for reducing feelings of stress and depression. And this has been shown over and over in non-pregnant people and in pregnant people. And so our questions went beyond this. We know that mindfulness alone does not lead to weight maintenance or weight loss. It does not lead to behavior change. It must be paired with other changes, with other intentions and goals. And so we devised a class to help with eating and nutrition, as well as mindful stress reduction. In our participants of 215 women, most of them were having all of them were having a single pregnancy, no twins. 33% were single. All women were recruited early in pregnancy in their first or second trimester. And the class was just 8 weeks for 2 hours a week. We also had some phone booster calls, and after the class, they knew they were going to gather again with their babies. And so they became very close in these small groups. There were about 10 per group, and they looked forward to meeting again with their babies a few months later. So I'll just show you what that looked like. That was always a very joyous reunion. And here we see the two mindfulness teachers and some of our participants. They're mostly women of color from different Bay Area communities. So what did we train in this 8-week class? We focused very simply on 3 goals: mindful eating, movement, being more active, and mindful breathing or meditation. And so they had a card like this on their refrigerator, in their wallet. And this was really the homework. Every week we talked about obstacles, successes and obstacles to how to improve moments in the day for mindful eating. There was inner wisdom and outer wisdom. The inner wisdom was very novel and valuable training of just paying attention to our interoceptive awareness, our feelings of hunger and fullness, and rating our hunger and stopping when we get to about a 7 out of 10 instead of mindlessly overeating until we might feel too full, which is easy to do, especially when we're stressed. We had them savor the food, really enjoy it and notice it. And we also had them make mindful choices before they started eating, so that one of the ways to prevent overeating is to use a plate method to be filling half the plate with fruit and vegetables and instead of carbs. And so that was one of the ways. The plate method was very helpful, and we've done this in other studies, and it does relate to better, less overeating. In terms of so that was the outer wisdom, the plate method, eat more of these whole foods, eat less of the processed foods. In terms of move my body, it was a really simple focus on staying in motion and not sitting for long periods, and enjoying walking, adding mindfulness to the walking, to noticing things they hadn't noticed, such as flowers or any green areas. In class, we did mindful yoga, mindful stretching, and we measured how much they were active, how much they walked after the intervention. And then lastly, we spent the last third of the class learning techniques for deep relaxation and ease, and compassion, self-compassion, as well as compassion for others. So in mindful breathing, we did a check-in. They became awareness of breath, emotions, their own body sensations, as well as the baby. They also, we also ended each class with a metta, or loving kindness meditation, where they put their hands on their belly and they said, the loving kindness meditation: may I be safe, may I be happy, may I be healthy and strong, may I live with ease. Then they repeat that with the words, may you be safe, may you be happy, to all the women in the room. And then they end with, may we all, and they send loving kindness outward. So they loved that part, especially when they could feel the baby. In the end, I'm going to jump to our results, and I will tell you that we had we indeed found that mindfulness helped with mental health. This was not a surprise. The questions for us was, how long did that last? Were there long-lasting benefits? Did we impact the baby's health? And also, were we able to improve nutrition and prevent excessive weight gain? Now, after that big trial, we did find some amazing findings, like the women had better glucose control, lower diabetes risk, but we did not reduce excessive weight gain. It's very hard to reduce excessive weight gain once you're pregnant. And so what we then focused on, we continued to optimize our intervention, and we added a cooking pot, fresh produce. I mean, you could talk all you want about mindful eating and nutrition, but to change that is a heavy lift if you have low income and you live in a neighborhood without easy fresh produce. And so in this optimized version where we actually brought fresh vegetables and recipes and did these cooking lessons, this is when we saw a dramatic improvement in nutrition during pregnancy. So it is possible to dramatically change diet during pregnancy with some support, with connecting them to fresh produce. In this one of our waves where we brought in the connection to the actual skills of cooking and produce, we had just so many delighted responses and novel experiences with different vegetables. So for example, one participant said, I recommend this class for any pregnant woman. It was life-changing. I eat Brussels sprouts now. I never would before. I ate carrots and cabbage before. This class took me out of the box of what I usually eat. So we taught them about the rainbow and really choosing widely. We improved nutrition, but also reduced sugar intake and soda intake. Now, the question about depression. So yes, you can see here, we reduced depression 8 weeks later. No surprise, this was a primary goal of the intervention. But what about 1 year later, or even 8 years later? So with Nikki Bush, we studied them long-term. And what you can see here is that even during the pandemic at 8 years later, well, when everyone went up in depressive symptoms, the women who were trained during pregnancy had significantly lower depression. This is the longest term outcome that we know of in studying any intervention for pregnant women for mental health. We know that during pregnancy, there's tremendous plasticity due to estrogen and other hormones. This is a critical period for promoting behavior change and changing emotion regulation pathways. Women are incredibly motivated, and we're here showing long-term benefits to reducing risk of depression. So what else? What about the babies? We actually found Nikki Bush tested the baby's stress responses and how they responded when they were had a stranger situation with the mom, when the mom was not responsive to them. And we found that the babies who went through the intervention in utero came out with more resilient stress responses. And so they had better sympathetic responses, they recovered more quickly, and they showed more self-regulation in their infant behaviors. So this was very exciting. We also found that these kids had a less negative temperament, and they also had fewer doctor's visits. So we're very excited to see these second generation effects. So this shows that for the moms who had depression, they had significantly more child visits, and the much more than recommended. They had closer to 15 visits instead of the recommended 8, and the intervention attenuated this association. So it helped improve, we think, the health of the infants for the moms with depression. So this is very exciting to us, and at this stage, especially seeing long-term effects, we're very excited and motivated to share this out and help community partners and healthcare partners implement the whole intervention or any parts of it. We know that these mothers are motivated to learn and benefit from some of these we think of this as well-being skills, universal skills. We're excited to support community partners in using our class manual. This is on my website, and it's quite a detailed manual, and our goal is to simplify it and have a train the trainer model so that we can support community teachers in using this. We would love to explore, we think it can be led by peer educators or community health social workers. We would love to test this in a healthcare setting and see if insurers will reimburse this. We started exploring this with HealthNet. They were very interested in it. And we'd also love to test this with a Zoom-based model. While we had good adherence, we also were able to pay for transportation and childcare. And so we know that a lot of women still weren't able to enroll and come to the class because of other commitments and limits on their time. And so we would like to test this as a Zoom-based class. So we think the live class is important, the social support is important. We don't want to take that out, but we want to see if this can be just as effective through digital delivery. And this is a list that Nikki and I like to share just to show that there are policy implications in addition to directly working with a group of women to reduce distress. There are many other ways to reduce distress. So Nikki points out here, just screening and referrals is not happening as much as it should. Screening for poor mental health during pregnancy. There are doula programs. Of course, continuous medical insurance is critical, as well as cash transfer programs. So we'd like to thank our supporters for this work, NIH and the Lisa Stone Pritzker Foundation. And I'd like to end with this beautiful love and kindness meditation that our mothers really loved and adopted. And so if you would like, you might put your hand on your heart or your belly and just read or repeat these words. And it helps to close our eyes when we say this. It also helps to slow our breathing. May we be safe. May we be happy. May we be healthy and strong. May we live with ease. And I know sending this love to their baby was something that they felt in their whole bodies, and they loved to do this together with other women. So with that, I will turn it back over to Dr. Ramos, and would love to answer any questions.
Thank you so much, Dr. Epel. Yeah, this is fantastic. And I'm sure our audience is probably very motivated to know how can they replicate this in their communities, and would love to know. So it was just 3 simple things: moving, as well as nutrition, as well as the third one being remind me, what was the
breathing, right? So it's
mindful breathing. So just simple, this slide right here. And so in terms of being able to replicate this, we have some programs already in terms of the nutrition portion. California has the WIC program as well as the SNAP program. Have you thought about, were any of your participants recipients of either one of those programs? And can you describe a little bit more about the nutrition piece that you
Yes,
implemented?
absolutely. And if you'd like, Alana, we could either take the slides down, or we could go to the slide with the 3 components. Okay, we'll go to the 3 components. Yeah, we learned that the bringing like instrumentally improving their nutrition, it's hard. There we go. Thank you. It's hard to create behavior change. It's hard to do it quickly. And because pregnancy is such a short and critical period, it is so important to partner with SNAP, with WIC, with food kitchens to make sure that we're addressing food insecurity. We had the luxury of bringing a bag of groceries once a week to each woman with some recipes, and that worked. So, if there is the opportunity to create a group, this is how change occurs. So most women know that they should improve their nutrition, they should reduce their stress, they should exercise more. The hard part is, how do you fit that into your day, and how do you find the emotional support that is so critical to reducing stress. So we would ideally, this is implemented in small groups. We had 10 or fewer women. They are in different stages of pregnancy, but preferably early. And one of the first one most critical kind of assessments is for food insecurity and connecting them to food resources. And our training was not was very light on nutrition, but the very fundamentals and basics about what a woman needs during pregnancy in terms of vitamins and folic acid, amount of fiber, amount of fruits and vegetables, and protein. So just knowing that, having a picture of a plate and knowing the healthy balance of each type of food was the most important focus each week, helping them figure that out and make that culturally tailored and attractive to their family as well. So so that was the part of the outer wisdom, and we know that group prenatal care is incredibly effective for stress and reducing pregnancy risks, birth outcomes, reducing preterm birth in some studies. But as you taught me, Dr. Ramos, that is not easy to implement for working women without the flexibility to spend several hours getting to and spending time in a prenatal healthcare visit. Our class was at night, and we had this in the community at a women's health center, and we had community members, women from the community, training in our curriculum and leading the class. And that was very important to be having it taught in the community and by the community. We do know group prenatal care can also help with weight, reducing depression and reducing excessive weight. And what we've done is take kind of aspects of group prenatal care by having a circle of pregnant women together and learning this together. And that is why they showed up. They had great adherence. They felt community, support, belonging. They shared the same challenges. So that would be my first hope, is that groups can be created and they can be more fluid. This was a research study that had a lot of requirements, but it could be different stages of pregnancy. And Nikki and I would be very happy to be in communication with any community partners who want to start to implement this class. And we feel that a next step would be having a group of community partners so that we can also brainstorm together on implementation.
Thank you. So along the theme of the holidays, which is, one of the reasons why we wanted to focus on this, what would be some examples of nutrition lessons that you would be highlighting around this time for holidays, so that our audience can then take it away and perhaps implement it with their groups?
Yes, this is such a challenging time for the large number of us who are stress eaters or emotional eaters, right? Because there's many more group gatherings. The food tends to be holiday food, which is, again, not the carrots, but the carrot cake and the sweets. And there are some ideas that I would offer. One is, this is a time of more stress and a mental health challenge for low-income women. There's more demand. There might be loneliness and isolation and lack of support. And that is, so there's the kind of overly busy and extra demands that are important to acknowledge and try to reduce. And then there's also the increasing connections, finding out if they have somewhere to go and they have people to be with. So those are both different types of holiday stress. We know that depression, anxiety, and suicidality do increase during holidays. Staying away from social media, those messages of that make women feel more alone and challenged. There's the question of viewing food as we do secondhand smoke. So if you're going for people around pregnant women, in the family, friends, really thinking about creating opportunities for bringing healthy food or having moving events, which being outside, taking a walk, rather than what we traditionally do, which is sit around with food for hours. The secondhand smoke analogy really is very powerful when we think about our, wanting to promote our community's health. Do we want to bring donuts and desserts? Or can we view that as secondhand smoke, that it is almost impossible to avoid eating if you are someone with a type of brain who's conditioned to do stress eating. And so there's very little, it's, putting food in the house and in front of people that is this type of processed or highly palatable or high sugar food is a true disfavor. It is so important to really create the conditions for healthy eating for people who are under a lot of stress.
Yes, great point. We have a very nice comment in the Q&A for you, and it really is kudos, but this is really important to bring to mind. And I would love to know if the meditation, the mind body lessons that you taught were used during labor and delivery, because the person in the chat writes that they work on labor and delivery, and that's something that they do. They do mindful meditation when patients are in distress and prior to placing an epidural, prior to an emergent C-section, and right when the woman experiences, sadly, a fetal demise. She uses that and has had positive results. And so I don't know if you can describe a little bit more about what you do with the mindfulness, and maybe some folks could replicate that in their care and their lives.
I'm so glad that our audience member brought that up. This is such a beautiful, and I will say critical and essential addition to the pregnancy and birth process. Bringing these skills in is not rocket science, and it has been shown to help with different birth risks and the birth process and postpartum depression. There is a program developed out of UCSF by Nancy Bardock called Mindfulness-Based Childbirth. And it's exactly focused on training couples or pregnant women in this skill set. So during the pregnancy, they're learning this, and then during the birth process, they're able to use this for delivery. And I would suggest that rather than thinking we have to adopt a program, should we adopt the pregnancy program or the mindful birth program or the the parenting mindful program, is invest in your healthcare force, your practitioners, in being able to train and give resources within these visits. And that is the easiest and quickest way to start the dissemination, referrals to audios, to programs, and doing some short breathing exercises within these patient encounters.
All right, thank you. Yeah, that's a great resource. I don't know if you can repeat the name again, and our team can put it in the Q&A so that folks can access it and look it up, and we can put it on our website as well afterwards.
Right. So it's mindfulness-based childbirth. And this is, there are many practitioners trained and certified in mindfulness-based childbirth. I think that's the correct title. So I would be happy to get you a link to that. It's probably on the UCSF Osher website, and the founder is Nancy Bardock. And that's
Thank you.
And so I think that these skills are so important for ourselves, for healthcare providers, for people working in the field, frontline providers, as well as for the families, for pregnant women and the parents. And so making this something you don't just have a link for, but you actually learn yourself, and you can model, and you can do this in within those short appointments, is very powerful. The healthcare provider is one of the most trusted resources. Nurses, particularly doctors, scientists are, they used to be among the highest, and they're a little bit less, but these are ways to be bringing this into the patient's life with both the practice and then a referral. And these classes are, the different cities have, different levels of resources, but this manual is very, I think, easy to bring in components of. And again, we're happy to bring in, we call it the mindful moms, bring in the our teachers to, help support any healthcare providers or community partners who want to try to implement some of these components.
That's fantastic. Thank you. And we'll just add, I'll share the second question before we move on. But the question is, have any CPSP programs, which is the Medi-Cal Enhanced Prenatal Care Program, use this model? The person says, I am a coordinator for my Indian Health Clinic and can see how it would be well utilized.
Yeah, wonderful. I don't know of any specific examples, but I do think that bringing in components and making them culturally tailored to that community are wonderful and powerful steps. And there are many, practitioners who are looking for opportunities to teach these, these communities that have higher risk. So this would be, I'm thinking, is there a clearinghouse for these teachers? But I think advertising in the community is helpful. We have been teaching some mindfulness skills to young adults in the UC campus system. At all 10 campuses, we've created a class to teach them these essential life skills for coping and resilience to the current climate, the climate crisis, the poly crisis. And we've advertised for mindfulness teachers and found many in each of these communities. Some of them are large cities, some are much smaller, but there are, this is a role in a training that is extremely popular now. And so we found professors with mindfulness training or, community members, and there's more than we can employ. So I think they're out there, and they're, the training particularly toward pregnancy, it's ideal to find someone who was a mother, someone who's from that community. So it's real grassroots.
Thank you so much, Dr. Epel, for this wonderful presentation. You really have provided us with resources that are simple, can be replicated, and we will put your information on our website so if folks want to reach out to you on how they can implement the program or have questions. You're going to become very popular soon. So,
thank you so much.
Thank you
for your time and your work.
And all right, can I please get the next slide? I wanted to highlight, again, going on with the theme of the holidays, just things that we can do as a community to support the mental health of moms, especially during the holidays. And as Dr. Epel had highlighted, sometimes there's loneliness, increased anxiety, depression. And oftentimes what we have seen is that information, resources are given to the mom, and we have overlooked the opportunity to inform and to share information for the people that surround that pregnant mom or new mom. And so this was an infographic that was developed as a result of one of our interns, Salani Shah from Stanford. She's an undergrad, future physician, has been accepted to medical school. But she did a survey of students and people, and we came up as a result of all of the work that she's done with these simple recommendations for those who are around a new mom to be able to do. We provided the data. 1 in 5 people in California have experienced depression during or after pregnancy. So just making folks aware of this is something that is not uncommon. But then more importantly, and just to have the family members have these tips at their as information. So to look for changes in behavior, and some of those changes could be as simple as they're not combing their hair, they're not brushing their teeth, and if they have a new baby, they're not really paying attention to the baby. So what's different? So look for those changes. listen for harmful words. And some of those are, I want to die. I can't do this anymore. I need help. So just to listen. Other things to provide words of support. As Dr. Epel highlighted in her presentation, it is that peer-to-peer, that community support that just makes it okay to move forward and to be able to provide those words of support to say, you can do this, we're here to help you, don't worry. Those kind words really can make a difference. And then finally, most importantly, to direct to areas and resources of support and care. And if there is doubt, just provide that support and refer them. And it's okay to have the conversation. Many times people are afraid to even talk about depression, and sometimes it could be the blues, but just to even acknowledge it, especially with certain cultures, you don't talk about it. And then, so that statement is just going to reinforce the fact that it's okay to have that conversation. And so that QR code is a code to resources and to more support. So we have this on our website as an infographic. You can share it on your social media. If you are a community-based organization, a healthcare system, please feel free to add your organization name, resources there. All of the information that we produce out of our office is available for folks to adopt and to put their name. We ask that you keep it the way it is, but you can absolutely put your referral information, your organization's name, QR code, so that we can, again, just improve the awareness of what can we do. And I was just at the Hospital Association meeting. I encourage them, before people are discharged from the hospital, have that conversation, have this in the room for the dads, the grandmothers, the friends that are coming to visit that new mom and baby, just to realize, wow, I didn't realize that these are the things I need to be on the lookout for. So encouraging folks to share this resource, be aware, and promote the fact that we can all be the eyes and the ears on the ground in the home, in particular when there are cultural restrictions of not leaving your home for 40 days, like in the Latino population. I know when I had my son, my mom said, you are staying home for 40 days, right? Well, it's not always possible, but there are people who will do what is culturally appropriate for them. So it's key to inform and to make family members and partners aware of these signs. So again, holidays are happening, and there's going to be new eyes, new ears. Everyone wants to see the baby, but let's not forget the mom. So if I can have the next slide. So wanted to share that resource. And we are hearing, what can we do? What can we do to make a difference with Strong Start and Beyond? Remember, our goal is to decrease maternal mortality 50% by December 2026, as well as to empower and to provide resources for folks to have a voice in their health. But along the lines of supporting new moms, and especially during the holidays, we are starting a social media campaign, and I am asking each and every one of you to really do one small thing for a new mom. And that's the hashtag, one small thing, SSB, for Strong Start and Beyond. And you can take a picture, take a video of doing that one small thing, whether it's watching the baby while a mom naps, whether it is straightening out the house. You can see here preparing a meal, walking with that new mom. I will even say meditating with that new mom, right? Teaching them, how do you meditate? How do you do that mindful breathing? Running some errands, bringing over coffee or lunch, a meal for a new mom. I can honestly tell you, I'm hearing from many people throughout California, new moms, especially when I would see care for new moms, they would express how lonely it is to have a baby. Nobody's coming around, nobody is helping them. And there was one mom that said, it wasn't until my neighbor finally came over and knocked on my door, and she was a single mom caring only for her baby. She said that I was able to sleep. That neighbor came over and I was able to take a nap. She said, I was going crazy because I couldn't sleep. the baby was colicky. So again, if we can do one small thing for a new mom, and right now we had 60 people on the call. So imagine if each one of us did one thing for one person and encourage somebody else to do the one kind thing, one small thing, we're going to have a big ripple effect, a big movement in California. And we're going to help support our new moms. And that's going to be making not only for a healthier mom, a healthier baby. The other thing that I would encourage to do in the one small thing is to encourage the mom to go to that postpartum visit, because we know that the 62% of the pregnancy-related deaths are occurring after delivery. So maybe being that ride to the postpartum visit, maybe being that babysitter while the mom goes to that postpartum visit. We can all do one small thing. So please help us promote one small thing. And can I have the next slide? And in wrapping us up, I also want to invite you to please sign up to be part of our Strong Start and Beyond webinars. The January webinar, the focus is to introduce PRIMA, our preconception medical assessment, that is meant to be accomplished and completed outside of the healthcare setting, not meant to be shared with the providers, and just to increase awareness and have folks think about their health outside of the healthcare setting. And really the focus is, are you thinking about becoming pregnant? Well, maybe these are some questions you may want to take to see what you can do to improve your to have a healthier baby. And that's what we are wanting: healthier baby, healthier mom, and improved overall health. So that's our QR code. Please sign up. And then finally, just to wrap up, if you haven't done it already, please partner with us with Strong Start and Beyond. We are looking to elevate the work that you are all doing. I had the privilege and the honor to hear about Dr. Epel's work in the Mamas program. If there's a program similar to what she's doing, we would love to feature you on a webinar, on one of these months' webinar. Also know that we are producing podcasts, Zoomcasts, so that folks can hear about programs that are happening throughout California. And we want to highlight the benefits that California already has. Elissa highlighted the doula program. There's also community health worker benefits and the midwife benefits. There's a lot of benefits that California is already funded, and it's a matter of how do we increase awareness and increase access. So if you have a program that you want us to highlight, please reach out. And if there's a social media post that you want to share that highlights your organization, the work that you do, send it along. We would love to, again, highlight what is being done. California is so rich, so innovative in the work that we are all doing, that together we are going to be able to reach that decreasing maternal mortality 50% by December 2026. And if I can have the final slide. With that, I want to thank you for your time and attention, and please feel free to reach out anytime to me directly or to our Strong Start and Beyond at osg.ca.gov. So with that, thank you for your time. Happy holidays, and we will see you on our next webinar next year. Thank you for your support, everyone.